one.
Good afternoon, everybody. I am Robert Hall. Again, we're with you with COVID Conversations. We are Project Elect, enthusiastic leaders engaging in changing times. We're constantly just trying to get the information out there. We want to be a conduit of information to the community, and we are just going to stay on it, as long as we can get the information out. Tonight, I'm with two awesome people. My normal side runner here, Dr. Vernon Rayford, who has been with us from the beginning. We call him the hardest working doctor in Lee County. He stays busy. I know he's with internal medicine here in Tupelo. But we have a very special person that's with us tonight that we're just delighted to have. Dr. Nika Sanders of the Sanders Clinic, OBGYN.
Correct.
Specialist medical doctor, awesome. Been here around, what, 5-6 years?
That's correct, since 2015.
Since 2015. If I did my homework right, you've been in this profession about 20 years.
That's right. Whoa, now I'm starting to feel old. That's right. I'm older than I look, I hope.
Wow. Well, welcome.
Thank you.
And thank you for taking your time. We know you've had a hard day. You're resting here, but you still give it back to the community, and that's what's special.
It's a pleasure to do that.
So to begin tonight, just go back in a little history, and we are rolling on a year, have rolled on a year into the COVID pandemic.
Yeah.
And you have been keeping the numbers, you've been looking at the data. So can you bring us up to date on what's going on with COVID now?
Yeah, so we are out of the winter peak. The numbers have settled down to lower numbers, but there are still a high baseline. Hospitalizations have decreased, deaths fortunately have decreased, and another important number that's, I'm happy to report, vaccinations. So the number of vaccinations in the United States have increased. We've surpassed 100 million doses of vaccines given, and that's an incredible milestone. And Mississippi, we've passed 1 million doses given, and that's another incredible milestone. We have a ways to go. There are many communities that need outreach for the vaccine, and Project Elect is working to make sure that we're doing things like this to get the information out, but we're also working with community partners to improve vaccine access. So another number that looks, it's looking better, we still have a ways to go, is the percentage of African Americans in Mississippi who've gotten a vaccine. And so as of today, that number is 29%. A statistic that Dr. Dobbs, the state health officer, quoted that last week, that over 38% of the vaccines last week were given to African Americans, and that mirrors the percentage of African Americans in the population. So there is good work going on in the state. We all know that we have a ways to go, but it is great to work from a point of success. I think we've gotten ourselves conditioned to hear the bad stuff and the challenges, but to hear that, we are making some progress. We still have a ways to go, but we're making progress.
Okay. Thank you for that. Now, I'm going to switch over to Dr. Sanders in a minute, but notice that we are actually probably sitting a little closer than we normally do. And I was watching CNN, which I don't do a lot of things well, but I watch CNN pretty well, but the guidelines are kind of changing with people that are fully vaccinated.
Yes.
Could you kind of expound on that a little bit?
Yeah, that's actually a perfect question. So yes, the CDC has recommendations for people who are fully vaccinated, and that's 2 weeks after their last vaccine shot. So 2 weeks after the second Pfizer and Moderna, 2 weeks after the first and only Johnson & Johnson, that those who are fully vaccinated are able to interact without a mask, as well as to maintain a distance closer than 6 feet. And there's also some recommendations in terms of whether people who are fully vaccinated will have to quarantine for the same period previously. What I will caution people, and we're fully vaccinated here, but I would caution people to think about the risk, of COVID. So we know that there are risk factors for severe COVID. That if there was a elderly patient who, is fully vaccinated, but would be at extremely high risk if they got COVID, I would probably maintain those public health measures as long as it, doesn't hurt them. The public recommendations have not changed. When we're out in public, masking and distance. Hand washing is always a recommendation. It's almost comical that we have to tell people to wash their hands, but that's always a recommendation. But yes, so for those people who ask the question, well, what's the point of getting vaccinations? We're seeing the first recommendations that kind of give us a glimpse of what a normal post-vaccinated life will look like. And, we still have some ways to go, but the beginning is fully vaccinated people may interact in smaller groups with no mask.
Right. Thank you for that. Now, we've talked to people about COVID and diabetes, COVID and mental health, but now we have a specialist here, COVID and women. And just looking at you, you came in tonight and you're obviously coming straight out of the clinic.
Yes.
So I just want to say, hey, thank you for giving that extra time. So how has COVID maybe changed your practice with actually dealing with women's health, first of all?
So we're fortunate that ladies who are pregnant must receive care and must deliver. So we were never under a shutdown as many clinics were. As an obstetrician gynecologist, of course, we take care of women. So I take care of women during pregnancy, but we also do wellness visits, surgeries, and so elective surgery stopped, but the obstetric part continued. So that would be the elimination of half the practice when this all started. So for several weeks in late March, kind of early April of last year, we were working about 2 days a week rather than our normal 5 days a week because we only saw pregnant ladies where we could measure bellies, listen to heart tones, do the ultrasounds and things that are needed. We did adjust by doing telehealth visits for some problems that we could have described. People say telehealth for OBGYN can get a bit sketchy, but of course we were able to take care of those patients until we could resume our normal schedule. The beauty of North Mississippi's healthcare center is the women's hospital is separate from the main unit, and so we're always a little bit insulated from what happens in the main. So by limiting the patients that were coming in and out of that small hospital kept us safe. Our numbers remained very low. There are a few COVID cases during pregnancy where patients were intubated and had preterm births and deliveries as a result of that. But overall, for this to be a tertiary care facility, I have to say I'm pretty impressed with the way that we were able to protect our patients during that scary time in healthcare.
Well, that sounds good. I would think it'd be really, really serious if someone is with a child and contract COVID. So is the care maybe more aggressive or less aggressive for someone that may be carrying a child?
Well, so being pregnant makes you high risk for COVID. The lung capacity is diminished during pregnancy. As you think about, as the baby grows, the lungs can't expand fully, and we know the respiratory distress that's associated with COVID is certainly problematic. The other thing is we have to make sure that because mom has to require oxygenation in order for baby to have the appropriate oxygenation, so it makes things difficult to manage. So if you're remote from term, if you're 6 months, 7 months, then we'll do what we can to prolong the pregnancy until an appropriate time. Any babies that are born prematurely, we give a course of steroids over 48 hours and try and optimize or weigh pros, cons to delivery preterm versus continuing the pregnancy. Fortunately, we can anticipate the respiratory decline with a wonderful team of physicians who take care of COVID often, and we've been able to say, this is our goal, and can you manage them on a ventilator until we can get the baby to optimal health. Sometimes it's best to deliver because it is extra work on the mom, extra work to breathe. It's difficult. You can't really put a patient in a prone position. By prone, I mean facing down when you're trying to monitor the baby. And so we have been able to plan deliveries in a way that gives the mom and baby the best outcome.
So can a mom pass COVID to an unborn child?
So that is a question that we're studying now. And we have explored multiple approaches to this. So when COVID started, our rules were very strict. If mom was COVID positive, we separated the mom and the baby because we felt like whatever antibodies that she was starting to develop would protect the baby partially, but we weren't sure, and so that way the baby can be monitored very closely. The second phase of COVID was, well, if you want mom to impart those antibodies, if she's going to breastfeed, then the best way to protect the baby was to keep them together. And then so mom could breastfeed, confer any antibodies that she was developing so that she could care for her baby. But as you know, well, you may not know, but as our policy changed, as we learned more about COVID, we started to test everyone who would come into the hospital, whether it was for a mandatory procedure like just to deliver or whether elective procedure for surgery. And what we started to notice then, because these were younger patients and their symptoms weren't as pronounced, that they were asymptomatic positive patients. So then we really had to reevaluate what we were going to do with babies. Are we going to stop moms from breastfeeding? Are we going to have them pump breast milk and send them to a different location to try and confer those antibodies? And how are we interrupting this bonding time that we've now known to be so critical? Only about 5 years ago did we start to say that the golden hour was important. When I had children, you had a baby, the baby went off to the nursery for about 4 or 5 hours for an initial assessment. They assessed the mom, and then we came back together. Our whole strategy and the plan for medicine now is to keep mama and baby together at all times throughout their hospitalization, and we call that rooming in. And so the nursery essentially disappeared. So this was a big change after we just learned to keep everybody together to now say should they be separated. And so what we did, if you were asymptomatic and mama was doing well, we encouraged you to stay together. The couplet stays together. And so that's our policy now. So it's only if the mom is not able to provide care for the child do we separate mom and the baby.
Okay. Wow, that's great information. And just remind audience, please take this video and share it. It's going to be uploaded on our Facebook. If you have any questions later, you can actually put those questions in, and Dr. Sanders or Dr. Rayford will actually get back with you on that. Again, we're Project Elect, and we're talking about COVID-19 now in women, and also talking a little bit about the vaccine. So getting back to the vaccine, Doc, there are 3 different vaccines out there now. And what I'm hearing is that one may be better than the other one. You want to get this one, you don't want to get the second one. So what should we do?
Yeah, so it's interesting now that we have 3 choices, and it's always interesting for me to hear why people have their different preferences. And what I will say is we're incredibly fortunate to have 3 very effective and safe vaccines. So the Pfizer vaccine was first authorized, 2 shots separated by 21 days, messenger RNA technology. Moderna was the second, 2 shots separated by 28 days, messenger RNA technology. Johnson & Johnson is the newest one. It uses a different way of delivering the information. It's a viral vector type mechanism, but it delivers the similar information to the cells to achieve the memory. It's only 1 shot. And I go back when I'm talking about vaccines to say, when we're looking at a vaccine, we want the vaccine to do 3 things. And 3 things in the order of preference, so that if you do number 1, we're okay with you not doing number 2 as well. We want vaccines to keep people alive. All 3 vaccines do that equally well, and they're essentially comparable. We want vaccines to keep people from having complications and being in the hospital. All 3 vaccines do that exceptionally well. And the third thing, we want to decrease disease. And you may see some differences in numbers. People are saying, hey, Pfizer says 95, Moderna says 94, Johnson & Johnson says 70 something. It's hard to compare those numbers because those are different type numbers. And so those numbers you can't really compare. What I will say is that number 3, all viruses do those very well. And it's well above the threshold that we use when we're considering whether we say a vaccine works or not. The 2019 flu vaccine was about 49%, 50% effective, and we know that flu shots are fundamental and beneficial. So just to show that, numbers that, just kind of you can't be so beholden on the numbers. So it's always a question, what should I get when? And the answer is whichever one you can get the quickest.
Go and get it.
Vaccine in your arm is better than vaccines in your mind. And so getting the vaccine, whichever one you can get, there's a lot of interest in the Johnson & Johnson vaccine. That the concept of a one and done vaccine, no follow-up appointments, and that vaccine is incredibly, that option is an incredible option. And if I'm talking to patients, I tell them I believe I could work for the vaccine company because I think I could tell you, because I'll tell you about the Johnson & Johnson for those people who are concerned about the top line number. I'll tell you that the Johnson & Johnson vaccine is one that, when you look at it, and I'm not working for them, it's a good shot. It's a good shot. So if you get offered a Johnson & Johnson, even if you have Pfizer in your mind, it's a good shot. There's some upsides about the Johnson & Johnson, particularly where they were studied, when they were studied in relation to some of the variants that we're now paying attention to. Johnson & Johnson was actually studied in a time and place where the variants, and they showed that they were that they worked exceptionally well. Number one, keeping people alive. Number two, keeping them out of the hospital from severe COVID. And so another point with the Johnson & Johnson is the side effect profile. So we know Pfizer, Moderna cause side effects. They're mild to moderate. They don't last a long time, but it's worth knowing. None severe, none leading you to be in the hospital. The rate of side effect with Johnson & Johnson's one shot is lower than the rate of side effects with the two-shot Pfizer, Moderna. So again, just to make you confident that whichever vaccine you're offered is a really, really, really good one. And we're fortunate to have 3 vaccine candidates before the 1 year of COVID in the United States, before, we're looking back to March 11th when the WHO declared it a pandemic. March 11th was when Mississippi had its first case. A few days later, Mississippi had its first death. We kind of, within that time, 3 excellent vaccine candidates. There's some more vaccine candidates in the pipeline, so that, there may be a future discussion when we're talking about 5 or 6 different COVID vaccines.
Wow, good point. I want to come back to that because right now I know that you're on the front lines. I mean, we've been working Project Elect. Fortunately, a couple weeks ago, myself and Kenneth Wheeler, Maurice Schompert of Project Elect were able to get the Johnson & Johnson because you were instrumental in helping a small rural clinic. And a lot of people get vaccinated, so you're on the front lines of it. Which brings me to you, Dr. Sanders. When it comes to pregnant ladies and the vaccine, is it safe for them to take it?
Well, let's start with women in general. Do I recommend that you should have the vaccine? I absolutely do. Have no reservation about you being vaccinated. So I'd say, yes, go and get your vaccine. The question then becomes, if you're planning a pregnancy, if you're currently pregnant, or if you're breastfeeding, then what do we do? So the American College of Obstetrics and Gynecology, which is our governing board, says that patients have the right to choose. It is not contraindicated, which says that you should not have the vaccine. They're not saying that it can cause harm to babies. It says that you have to weigh the consequences, pros and cons. So educate yourself and decide at what point would you want to have the vaccine. So my approach has been this for patients. If you're going to be vaccinated and you have concerns, delay your attempts for pregnancy until you've completed your vaccine. And then go ahead and resume trying to conceive. If you are now pregnant and you have concerns about that, then at one time it wasn't available to you, so it wasn't an option. It's only been recently that we've opened up the numbers to everyone. We know that pregnancy is high risk, which means you have qualified for vaccinations for some time. And for those who are concerned, I say, okay, well, let's plan for that vaccine as soon as you're delivered. So then they say, well, Dr. Sanders, I'm just not sure. What is it? Is it going to be excreted in my breast milk? what's going to happen in that regard. And I'm saying that we are gathering information at this time that will give us more information. When you do clinical trials, you're not going to run the test on someone who's pregnant to run that risk. We don't run the test immediately in children. We start with the given population, study it there. As we learn more, then we learn if we can give it to younger and younger and younger patients, children. And so we'll have the information to say that it is safe during pregnancy soon, but right now they say it is not contraindicated, which means it is safe to receive the COVID vaccine during pregnancy and during lactation.
So you, as a medical profession, in the field over 20 plus years, and in your specialty, you're saying that, hey, we need to get this done.
We do.
You're saying get the vaccine, get something.
Yes, I recommend that everyone be vaccinated for sure.
Okay.
There are vaccines that we give in pregnancy now. Dr. Rayford mentioned that we're vaccinating for flu vaccines during pregnancy. We're recommending Tdap vaccines, which is whooping cough, pertussis, tetanus vaccines, which we receive. The only vaccines up to date that we think are contraindication are live vaccines, and that is not how this vaccine works. So there's nothing about how we know that this vaccine works that would say that you should not take it during pregnancy. But of course, I take care of a population outside of those pregnant women. Where mothers get their health care dictates what's going to happen for the rest of the family.
Wow.
And so we need female leadership to say that I'm having the vaccine, I'm going to encourage my husband to have the vaccine, I'm going to encourage my parents to have the vaccine, because women often decide kind of the health care, what region, where we go for health care, everything. And so it's important that women are vaccinated.
Wow. I don't know how more defined and seriously that can be put. So, all right, now, Dr. Rayford, you just came off another site that you helped become a vaccination site, Ms. Nancy Hooks. They're out there working hard and going to continue to work hard. But there's still people out there. There's still a lot of African Americans that said, I'm just not going to do it.
Yeah.
What do you do to get the message over to that person? I'm just not going to do it.
I think Dr. Sanders has it right. You find the leaders, the key people, the key gatekeepers in their life, and you empower them to let them know. So there's a lot of vaccine interest that I've noted in the in my patients, and there's a lot of vaccine interest, and so really making sure that we can get access to those people who are interested. And so, I'm thankful. I'm working on behalf of Project Elect to help troubleshoot and help people become local vaccine providers. I think that as you look at different groups you're trying to reach, I think there's some value, particularly in the African American community, that African American are providing some of the vaccines, and we're working toward that. It doesn't mean that you just have to have an African American provider to give the vaccine, but it is something where people can say, hey, we know, Nancy Hooks, nurse practitioner in our community, and she's providing the vaccine, and she is on Wednesdays. And we'll have information that you can call her clinic, and as well as Amanda Griffin, a nurse practitioner in Holka, who's providing the vaccine. And we'll be able to, in Holka or New Holka, but it's really important that we are focusing on access, we're focusing on trust, focus on the gatekeepers, and like Project Elect and some future is also helping people get the information out, a campaign where people can share that I've been vaccinated, I've gotten my shot, and working at messaging, that we're all taking our shot to defeat COVID, our shot at defeating COVID.
I had a question to come through.
Sure.
And they want to know how do you know where to go to get the different shots? You mentioned the Johnson & Johnson and the others. How can you find out where these different shots are being given?
Yes, so some places announced what shot that they're given. I know Nancy Hooks has been given Moderna. I know, I'm not sure what Amanda Griffin is given now. I know she's given Johnson & Johnson. Just a word to note, Johnson & Johnson's supply has been less predictable than Pfizer and Moderna. That there's a lot of demand, and Johnson & Johnson actually hadn't kind of gotten their supply chains together to where it's coming. So the State Department of Health has been sending select sites, Johnson & Johnson, and that's noted on the State Department of Health. When in doubt, call your anticipated vaccine provider and ask what they're delivering. It's hard to know, like even through our clinic when we are giving the vaccine, it's hard to know if it's going to be a Pfizer day or a Moderna day. I know for sure that we don't yet have Johnson & Johnson. And so it's going to be kind of checking, being on the lookout. I anticipate as more and more options come available, I anticipate that the vaccine providers will say what they're given, which is important because there's some age groups. So Pfizer is the only one that's able to be given to 16 and 17-year-olds. So knowing which vaccine is important, you don't want to take your 16-year-old, I anticipate as time goes by, we'll have a lower and lower age threshold. But as of now, Pfizer is the only one that's authorized for 16 and 17-year-olds. So knowing which vaccine is important, and if you get Pfizer, Moderna, it's important that you get your second shot of the same kind of the first. So if you started with Pfizer, second is Pfizer. You started with Moderna, second is Moderna.
Thank you for that. That's appreciate that, Mr. Wheeler. So there's a question that I have, and I don't know which one want to tackle this, but watching CNN again, which I do very well, we were looking at something called the long haulers, which meant in my mind people that had COVID, but they're still today suffering the effects of COVID. Is this something that either you have seen in your practice, the after effects?
I take care of primarily young, healthy populations, which means that if they had COVID, they were pretty resilient and bounced back. So to see some of that. But what I will say I have seen is that a cough that kind of lingers for a while. Patients say fatigue and that loss of sense and smell kind of lingers for a while. I think there's some more serious long-term effects that Dr. Rayford could probably speak to. But, for someone who's young, in their 20s, when we still think we're invincible, to have a cold that lingers for 3 weeks, they think that's terrible. I'm still coughing. Or I don't have my energy back. They've never had an illness that has made them uncomfortable for that length of time. And so that speaks to, if that can happen to a 20-something-year-old, what is it going to do for someone who's 50s or 60s, and perhaps Dr. Rayford can talk about that.
Yeah, so we're learning more about the kind of the long haulers. We really hadn't figured out a term for it, and really determining symptoms. So persistent shortness of breath, persistent cough, and not just persistent shortness of breath, but notable changes in lung function, that people who were otherwise young and healthy are having lung functions of people who smoke for 20, 30 years or have had bad asthma. What I've found more that I've seen a lot is people having effects on their thinking, feeling like months out they're not as sharp, feeling like they just can't focus, they're in a fog, and it's been pretty significant for some people. People have had changes in their occupation based on their no longer ability. A lot of people have decided to just retire after a bout of COVID. We know that there's been studies to show that a significant number of people who don't have mental health issues develop it after they've had COVID. And that number is 1 in 5, according to some studies. And so this phenomenon of long hauling, it's another serious thing that we need to, think about when we're talking about, hey, what's the alternative to having a COVID that can kill you in the acute phase, can maim you in the long-term phase. And so when we're balancing, wearing the mask, doing some of those things, when we're balancing, we need to balance it against a deadly, disabling, contagious disease. And so when we're weighing vaccine or no vaccine, we're not weighing you just be fine. We're weighing this thing that we're learning more and more about the bad effects. And I anticipate as time goes, we're going to be like, Oh my goodness, this is going to be, I mean, can you imagine 30, 40 years ago, there's going to be a COVID generation? Who knows what that's going to, in terms of the effects that we're learning. I mean, and we're talking about the physical effects. We hadn't even gotten to the sociological effects, the educational effects, the, psychological effects that's happening now because of this virus. So it's just kind of adds some extra fire to our push to just make sure that people are informed, about the vaccine and really informed about what they're choosing between.
I'd like to reiterate that point again, because I think that was the process I went through when deciding should I be vaccinated or not. So I'm being honest to say, was I hesitant? Absolutely. In the way that I practice medicine, I've never been a person who was the first one to jump on board with the newest technology, the newest medicines. I've always been kind of a little bit mainstream. I like to see the medicines roll out. I like to see what their side effect profile will be. I generally don't give medicines until they're about 5 years old or so. It's just been my practice pattern. I'm guarded in that way. But Dr. Rayford had an excellent point. We're concerned about what could be a side effect with a vaccine versus what you know to be true with COVID. You know you can die. You know that you can have long-term effects from that. And so I think that while you may be concerned about the possibility of what may happen for the vaccine, we know that if you contract this disease, that you can die. I've had a patient who, everybody's heard some sad story, but the one patient who stands out in my mind, once we started doing wellness visits again, we talked about depression because she'd lost both her parents to COVID. And what they think happened was someone who was younger came around her parents. Her father got sick first, her mother subsequently, and they died about 6 weeks apart. And so that's what we know. Now, I'm from Greenwood. I'm from the Delta. The Greenwood had the second case of COVID in the state.
Okay.
We have limited resources for health care in that environment. And when the numbers started, if you contracted COVID, you had a 10% chance of death. I tracked the data in my hometown. Why did I do that? Because all of my relatives are there. And so that's where they receive their health care. And so if someone says you had a 10% chance of death, wouldn't you do something to stop that?
I think so.
We think about things in terms of mammogram, about finding breast cancer, and colonoscopies in terms of, finding colon cancers and the preventive things that we do. But, to know that that is your risk, I'm going to receive this vaccination because I don't have the luxury of waiting to see if the vaccine will cause side effects, because I know what the disease can do to me. And so patients should be vaccinated.
That is great. One question, there's a young lady that I know that have had COVID. I think she's probably mid-40s or so, but still shortness of breath. And she's really nervous about that. And I'm sure she's probably going to watch this video. So I'm trying to get some information.
She should see a pulmonologist. We should follow her pulmonary function test to see what the impact of that will be.
Okay.
40's young. We're not thinking about long-term things, what kind of health you've been in. But if she could have taken a vaccine that would have prevented that, I'm sure hands down, at this point she would say, sure. Now let me make this a little bit more personal. And in approaching this talk, I debated whether I would share this or not. So my family has had COVID. Fortunately, from great healthcare providers like Dr. Rayford, nobody was seriously ill. My mother, I won't tell her age, I may get in trouble for that. And my aunt had procedures done, and they were here recovering. They were going out to receive therapy. I go out into the hospital every day, and we have 2 children who were going to school every day. We think we take the appropriate precautions. I took clothes off when I come in. I'll take a shower. My kids know hand washing protocols, and we did well until January. My son had a low-grade fever. We kept him home from school. Didn't really think much of it because he didn't have any major symptoms. And then the following day, my mom lost taste and smell. So then we were all tested. Now, every member of the person in my household, my mother, my aunt, who were both recovering from some surgeries, my 2 children, and my husband were all COVID positive.
Wow.
You know who didn't have it?
You.
The healthcare worker
Wow.
who goes out. And you know why?
Wow.
Because I was vaccinated. My vaccination I had received. I was beyond that 2-week window, 2 weeks beyond the second dose, as Dr. Rayford spoke of. And so I think that that's a testament that I'm living in the home. As a mama, I'm in the kitchen cooking and doing whatever and tending to everybody else. And I'm the one person who did not have the disease. Now, granted, their cases were very, very mild. But I felt like if this is no better testament to what the vaccine can do, and we thought, surely my family should know
Yes.
how to protect themselves.
Thank you for sharing that, because I know that's personal, but I think you care enough about the community to share this. Why, and that's your heart, your family.
Right.
So thank you for that. That's great information.
That's
That's great info. So, and I've kept y'all. I think we're rolling on 30 minutes. I don't know, but I do have a couple of final things that I will say. One is in the security realm, which Kenneth Wheeler, you might can appreciate this. I have noticed that when some people get their vaccinations, and they're very proud of it, and people on Facebook listen to this, they'll take that card and they'll get on Facebook, and you got date of birth, name, all this stuff on there. As healthcare professionals, I know they're happy, but what would you say to that?
Yeah, don't list your date of birth. Tell somebody you got your vaccine, but don't list your date of birth. Take some cybersecurity protective measures, because you may be getting called from your cybersecurity monitor that somebody's gotten your identity. But yeah, tell somebody, but tell them in a very smart way. That card is. Hang on to that card. Who knows what that card is going to be used for? I mean, who knows? That may be, a way that you can kind of show you've been vaccinated so that you can do more normal stuff. But yeah, block out your your date of birth and watch the information. Sometimes you may have even more stuff like a medical record number. Don't show that.
Don't show that.
Tell them you got vaccinated. Just say I got vaccinated, or show the advantage.
So we're getting ready to close out, and as you know, why are we keeping having these conversations? Because there's new information daily, and we feel that it's important, and Project Elect is going to keep coming to you with more. And so, of course, I'm Robert Hall, I'm the chairman, Project Elect, Enthusiastic Leaders Engaging in Changing Time. We are about ready to pull out.
How about, so Robert,
You
I
got
actually
one
have one question, one really important question.
Because I wanted you to have the closing argument.
Well, I'll get the closing argument, but I wanted to, I talked to Dr. Sanders about this important question because it's actually come up. I've been on some lunch and learns where there is a concern amongst young women about the effect of the vaccine on fertility. And some have been told to not get vaccinated because of that, and some have not pursued vaccinations because of their concern. And so I wanted Dr. Sanders to talk about, her approach to the young women that she's seeing who aren't pregnant yet and want to be pregnant, and their concerns about fertility and the vaccine.
I think the concept that this is messenger RNA and this is new technology for vaccines has really caused some concern. And so without getting too into, how we transmit DNA from parent to child, is to say that the messenger RNA replicates and transports information in our data, but it does not affect the nucleus, which is the brain center for everything.
Down, right?
Yes.
Okay.
So what I'm saying is that in the way that data is transmitted whenever we have children should not be affected based on this vaccination. And that's what I think people are saying. Is it going to alter my DNA? Is it going to change, kind of what God created for us? No, I do not believe that. And here's what I'll tell you about fertility for women. All the eggs that we have that are going to turn into children later, we're given at birth. So we're not making new eggs for new genetic information that can be altered by this messenger RNA. Number one, it doesn't impact the area where we think that it will be transmitted to children. That's already in us, already preordained by God. Okay? And so, as the sperm and the egg get together, then that's already happened. Now, what this messenger RNA is doing is teaching our body to make proteins that will help us change certain structure in cells to decrease the likelihood that we can contract the disease. And so, no, we are not modifying our genetic material. We're not going to have a new age of babies. There's no evidence for that at this time. Now, I did say that if you're going to become pregnant, would I be vaccinated, use barrier contraception for a while, and then go to trying to procreate again? Then absolutely, I would recommend that. But it's not to say that this is going to make you barren for years to come. So, no, it won't make you sterile. No, it's not going to make you grow an extra horn out of your baby's head, any of those things. That women were given all the eggs with all the genetic information at birth.
Got you. Dr. Rafer, I do have one thing. I know this is getting long, but this is good stuff. Now, people in profession know their profession.
Mm-hmm.
There's this old saying about the bum technician. I've used this before. He's wearing a T-shirt, and if he goes running by you, and he's a professional bum technician, and he says run, I think it's time to run.
Yep.
I guess my point I'm getting to is talking to the medical doctors here on stage, and they are giving this information to us. I'm going to say if Dr. Rayford and Dr. Sanders feel that it's important to get this vaccine, I'm going to go get it. I'm going to get it. So in closing, do you have anything to take us out on? Or
Yeah, so I want to thank Dr. Sanders for taking time. She's definitely taken time, out of practice away from her family to show the community how much she really cares. That's been apparent, you just ask about Dr. Sanders, and she doesn't have enough space for all the folks who want to see her. And so I want to thank her for taking time to join us in Project Elect. Thank her for taking care of women and babies and in our community for these last almost 6 years now. Wow. And our hope is that this is home, and we'll talk about, hey, you've been in Tupelo 20 years now. But I want to thank her for participating. Definitely an excellent perspective on COVID women. So you're right. What we want is for you to see that this is something that we have really looked at, is something that fits within our professional training. It fits in us taking and wanting to prioritize the health of our patients. And I'm asking people to trust me. Trust me that I've looked at the process. And so, as their provider, even in the community, I'm saying, it's gotten distracting. Last year, there was a lot of distractions, and trust was a big issue. And so, you can, and I'm asking people to trust me. I've looked at it, and not only that, trust and watch me. So I'm encouraging people getting the vaccine after, I'm encouraging people getting the vaccine. I've gotten it. I encourage people getting the vaccine, and the people in my family when they were eligible for it, to say, look, go get it. I want you to get it. Let us help you. Let us help you figure out how to log in and sign up. And so to really trust me, trust Dr. Sanders, as we're saying, look, this is something that's going to be helpful for us. And, and I know that it's going to take more time to deliver the message, and, and that's fine. It's a message that's worth delivering over and over again. So, we really want you to, and if you're still on the fence, trust me with your questions. Trust me with your concerns. Trust Dr. Sanders with your questions. Trust Dr. Sanders with your concerns. Because what I hope you see is that we're not just going to, I know that there's an approach that just don't work. Nothing's going to happen, just do it. That approach, and I think that's an approach that many in healthcare have taken, and may not be a culturally competent approach. And you may have people with legitimate hesitation who's not willing, that kind of, how could you question this vaccine? I remember myself saying, how can you question whether you're going to get this or that? It isn't. But that's, a very dismissive way. And my hope is that you're not getting that from us. We've looked at it, we're showing you the perspectives, and we hope that you can take advantage of this incredible opportunity, or take advantage of our time and our knowledge and ask us about those concerns, because there may be concerns that others have. And I'd actually like to give Dr. Sanders the last word since she's our guest.
I agree. My hope is that we will be vaccinated, and I say we, the African American community, the minority community, that we will be vaccinated and vaccinated timely. I think that's the other thing, that we don't want to be behind the 8 ball on this. There have been many studies to say how we're impacted by this disease, and so it's available to you. We're trying to make it readily available and easy. Go and get it while it's readily available. Let's be timely in getting our vaccine so that we can get on with our lives.
Wow. Tell you what, can't close no better than that. Thank you. Thank you for all that you do and for helping taking care of us. And likewise, Dr. Rayford. So we're in closing now. I will say that there's other videos that's going to be on Facebook. A couple weeks ago, we had a mental health professional on it talking about COVID and mental health and the after effects. So again, Robert Hall, we wanted to thank Maurice Schumpert, the man behind the camera, Kenneth Wheeler, our co-chair of Project Elect, and the man that make this room possible. So thank you for letting us use the medical center. So with that being said, have a good night. Until next time. Bye-bye.